arada. Takip ettiniz mi bilmiyorum. Dear participants, good afternoon from Ankara, Turkey. Today, our guest is His Excellency Armin Andereya, Ambassador of Chile in Turkey. Good afternoon, Mr. Ambassador. Welcome to our webinar series.
Good afternoon, Professor. Let me start by thanking you for this kind invitation, and also to express my thank you to the University of Ankara also for the initiative. It's a very good opportunity to share some impression, views, and common interest on this matter.
Thank you very much for participating, Mr. Ambassador. It's been our honor to be able to share this time period with you. And I would like to thank you also, just like you have done, on behalf of Ankara University for participating in our webinar series. We are going to have about 5 questions, Mr. Ambassador, and if you would allow me, I would like to proceed with my first question.
Please.
Thank you. The first thing I would like to ask is about you, Mr. Ambassador, and your mission in Turkey. Could you please be so kind to introduce yourself to the participants of our webinar and say a few words about your feelings on your mission in Turkey?
Well, I'm a career diplomat. I have been posted in Buenos Aires, in Argentina. That was my first post. Several, or many years ago, to be honest. After that, I also served in our embassy and consul general in Germany, and in the Netherlands. After Netherlands, I was posted in our mission to the United Nations in New York. That was at the time when Chile was non-permanent member of the Security Council at the time of the invasion of Iraq. After that, I served also as a deputy head of mission in Peru. And following this appointment, I was named ambassador to Austria, and also permanent representative to the international organizations based in Vienna. So in my current post as ambassador to Turkey, I arrived here in September last year, and it's a very challenging post here. It's a very diverse activities. We have a long-standing relation with Turkey. Chile was the first Latin American country to recognize the newly Republic of Turkey in 1926. And since then, we have had always a good relation. We have a very active, dynamic business relations. Business relations that we try also always to expand and diversify for both sides. We also try to have already the best political relation with the country, and also fluent contact with the parliamentarian level, but also with universities, business community, and including also the cultural area. I said that it's a challenge being ambassador to Turkey, because Turkey is a very dynamic country that playing a key role in the regional area. And trying to follow in the political development is a real challenge.
I see, Mr. Ambassador. Thank you very much. Maybe we should also point out that Chile, as you have said, is the first country to recognize the Turkish Republic in 1926, yeah, and is also the first country that signed a free trade agreement with Turkey about 10 years ago it was, if I'm not mistaken. But we'll get to that point later on. We're going to speak about our collaboration. But the second question is rather a question about this year. Not a very positive one because of the pandemic we're living. Rather, we could call it a tragic event, I think. But I would like you to give us some information about the pandemic in your country. How is it affecting Chile? What are the difficulties of COVID-19 in Chile? And what are the general measures being taken?
Well, the first case that we confronted in Chile was at the beginning of March. Was a young couple returning from his honeymoon from Italy. They arrived to Chile, and a couple of days later, they must go to the hospital because they feel really bad, and there was COVID-19. Around a week later, the government closed the borders and mainly took the same measures that took the government of Turkey, closing the universities, schools, activities, cinemas, all this kind of situation. And we work in the same vein that did the government of Turkey, applying for a targeted restriction in trying to put all our interest in these cities in which the problem was facing in the most severe cases, or part of the cities also, like Santiago, in which was locked down 1 or 2 districts, and the rest of the city continues its normally life. But we have there 2 different, totally different periods, starting from the beginning of March till mid of May. The situation was under very well control. Rarely we face figures of new infected higher than 1,000 people. I guess it was a couple of days, no more than that. The focus of the concern of the government was to trace every single case, to adopt the necessary measure to confine these people in his home to have this quarantine, and also to provide some help for the community that was unavailable to work and receive his salary. Mainly try to avoid that these people lose his place of work. When we starting to believe that we will have reached the peak middle of May, because the reason why the government and the authorities of health believe that we reached the peak was because the figures of new infected people was steady around 3 weeks and also decreasing. But suddenly they literally jumped the figures of new infected, going also higher than 6,000 cases by day in different cities.
Excuse me, Mr. Ambassador. This is important. I wanted to underline this part, if you would allow me. So you had the impression as a country, as Chile, that you had reached the peak in May, mid-May.
Mid-May.
Yes, because you had 2 or 3 weeks of steady cases, number of cases.
That's true.
And even a decreasing in the cases.
Yep.
But suddenly you had a higher number, a jump, as you had said, and we realized, or you realized, that it was not the peak.
No, it was
Is it
not
so?
the peak. Because the focus of this new situation was different at the beginning. That goes to affect the most populated areas outside Santiago or at the border of Santiago, and also to other main cities in Chile. Mainly areas of overcrowded people. Big families living in small houses or apartments, people that are unavailable to isolate themselves, or people that were unavailable to not to work, not stay at home, because they need to go to work every day to have the necessary means to live. That obliged the government to adopt a total different strategy and lock down the main cities, go in help to these people, providing them boxes with food, providing financial help, starting first for the most needed people and then increasing to other levels. And this lockdown affects, for example, Santiago since 1.5 months. Valparaiso, the main port of Chile, more or less the same time. But now, after all these measures, we see again a strong decrease in the number of new infected. The current figures are around 2,000 cases daily on national basis. So the government is working very hard in PCR, making a lot of PCR. We are making around, let me see the figures here, 70,000 PCRs daily in Chile in order to have the control of the situation and making a very strong trace of every single case. So that managed the situation in which the figures now again are under certain level. And the government decided to go with another strategy to, before, start to reopen the cities. And that is, the government made public a couple of days ago 5 criteria that should be arrived every city before to be in a position to ease the current lockdown. So we are really confident that in the next couple of weeks, we can start to open the principal cities, starting by Santiago. Perhaps not Santiago itself, but part of the city. We have to consider that around the 70% of cases of contaminated, infected people were affected in Santiago. So we are confident that the worst part of the crisis is over and that we are close to see the sun again.
Let's just hope so, Mr. Ambassador. It has been a very, very important statement for us, because especially the part where you mentioned that it had been thought that the peak had been reached, and it wasn't actually, seems very, very important, not only for our country, I mean Turkey, but all the world. So we may have new jumps at any moment. So we have to be really and really careful about reopening our systems and countries.
Yes, because it's not just to be optimistic, saying, well, the figure are going down since the last 7 days or two weeks, but even after 3 weeks, with good result, decrease in numbers, and suddenly the figure from one day to the other day started to be double. So that means that we could also say that perhaps was this second wave immediately, although that's not the official position. But it's a situation that need very careful before make any further steps in decreasing the level of control, to open the lockdown to the cities or part of the city, part of the cities.
Thank you very much, Mr. Ambassador. I really appreciate these statements and this information that you have provided. The third question is quite relation with this pandemic. How did the healthcare system in your country, in Chile, help the fight against the pandemic? What were the measures, the principal measures taken, and how did the things progress?
Well, when we start to receive the first information about the pandemic in Wuhan, the health authority started to work on the planification on the eventuality that our country would be hit in some specific moment. And then make a planification integrating the public service and the private service, and to acquire some additional respiratory devices, just in case. The health system in Chile resisted in a good way the situation, although we have to recognize that in Santiago and other cities, the level of the capacity of the medical center reached figures close to 90%. And all these cases, the government or the health authority decided to send a number of patients to other centers in Chile, mainly south part of Chile, in which was more capacity available to receive this patient.
So they transferred some of the infected patients from the capital to the south, to other provinces.
And when in other part of Chile was an extremely complicated situation with one specific or two specific patients, they will also take to Santiago to receive this more dedicated attention. But the main issue is that was a share of the patient sending from to the north part of Chile or to south part of Chile, in which they will receive the necessary treatment, and in centers that have the capacity at that time to receive more people. So in this way, we avoid critical situations, specifically in Santiago.
I see. I see. Well, could you please, we know how productive is the Chilean economy. We know the major lines of production of Chile, minery, agricultural products, etc. Could you please point out some specific sectors, such as tourism, agriculture, pharmaceutical industry, etc., and how they were affected during this pandemic?
Well, I will say that all the sectors were affected, but one of them hardly than others. At the beginning, our export sector was badly affected or severely affected because all the export were stopped suddenly. And we export a lot of fruit and agricultural product. And the container with all this production was in the port, in the different port in Asia, mainly in Asia, and was not possible to take out at that time. But after a short period, the situation was eased, so they restarted the work in this area, in this field. The problem also was with the tourism sector. Mainly the hotels, most of them closed the doors and sent his workers, his employees home. Some of them could telework. But that was a complicated situation, additional complicated situation, because they missed the winter season. After 10 years, the ski center received enough snow to extend and prolong season, and they remain closed. That is a huge burden for all the sector. Principally because they affected so many people that are working in this relation. The mining sector is also affected with this situation because at the very beginning, the copper is one of our main product of export, the price of the copper fell down. When the price recovered, our mining sector, the virus go into the mining sector, and we have to stop the production in at least two of our main miners. But it's part of the problem. The sector, Chuquicamata specifically, one of the main copper mine, was literally locked down for a specific period of time in order to control the pandemic. The airport of the city, part of the city, was also under extensive lockdown until the figures go down. The health authorities authorize to restart some part of the production and so on. But that all is part of this pandemic, and we know that we have to recover the level of activity that we have had at February this year. So all the measures are in this direction, starting by sectors and not all together, in order to avoid crowded cities or crowded buses and so on, services and so on. We need a little bit more patience, more dedication, and wait.
Exactly, Mr. Ambassador. I guess I understand, we all understand that we need time to combat against this pandemic and to start up with the recovery. We are not going to have quick results, if I'm not mistaken. One question. Chile is a mining country, but just to underline the level of the mining structure of the country, as far as I know, Chile produces 1/3 of the world total production of copper. Is it so?
Yep. Normally, well, it depends in the moment when we have to consider. But Chile is one of the main copper producer of the world. Sometimes we are the first producer of copper, sometimes we are the second one. But we have the biggest mining copper of the world in Antofagasta, specifically in the desert Chuquicamata. And well, this mining was severely affected.
I see. Thanks for the information, Mr. Ambassador. My fifth question is about cooperation. The cooperation between our countries during the present pandemic and afterwards. What would be the necessary steps to be taken to improve, increment, develop more our cooperation after pandemic period? In this context, I would like to express that Chile is the first and only country up to now that has signed a free trade agreement with Turkey.
Yeah. Well, I guess that this pandemic show us very clear that we cannot fight alone against it. It is really necessary the help of the international community, of the international organizations. the health ministry said a couple of days ago that he missed a lot this international cooperation at this consolidated point of view, at least at the regional level, on how we shall to deal with this pandemic. And to avoid situations in which countries start to dispute themselves about the necessary equipment, and avoid also the artificial increase of the prices of this equipment, especially the respiratory devices. The possibility that the international community come together and share experience on how manage a country like Turkey with this situation. How did, I don't know, Spain, Italy, Chile, and so on, which kind of problem face here and there, and how they resolve the situations. And that is really important. And for the future, try to prevent, or at least try to learn from the lesson of this pandemic. We need to come together and find a common solution for the second wave. And the second wave is there, close. We need to also to recognize that it's a real and big problem to the health system, a big challenge to every national health system. One, specific countries have more ability to fight against this pandemic, more resources, more equipment, experience, and so on. But other countries are really bad in needed, a lot of need. And we need to work also together in the international organizations and try to agree some specific policies or directives in order to be ready for the second wave, for the future situations. But we cannot continue working alone. This is a lot of effort. I would say an unnecessary effort. Instead of competing, cooperations is much better in this field. Thank you, Professor.
I see. Competition was a word that was widely used up to now. Now, maybe we should use the word cooperation more and more in every aspect of international relations and our daily life, maybe.
Yep. Because we're dealing with persons. That is the problem. And we all try to make the best, of course, the best effort. Every country are doing his best effort to fight this pandemic and to protect his people. But if they receive some cooperation in the field and saying, well, we manage this situation in this way, or we handle this situation in this way, and in our country works, why don't you try the same? That could be a big help. When we speak about cooperation, it doesn't mean donations. Some countries need donation, of course. Others can manage by themselves. But I mean, it's more this come together and discuss the issue.
I see. I see. Thank you very much, Mr. Ambassador, for participating in our webinar and for expressing this very, very important points that you have mentioned about the situation in your country, which could and would be very important to observe, not only from Turkey, but from all over the world. Thank you once more, Mr. Ambassador.
Thank you very much, Professor. See you around.
Good afternoon. Buenas tardes.
Buenas tardes.